Yes, sir. Can I have your name and where town you're from?
Yeah, my name's Jerry Silverstein. I'm from Calverton, New York.
And why are you here?
I'm here because my congressman had a town hall and it was disrupted and overwhelmed. He wasn't allowed to speak. That's Tim Bishop. And a lot of the things that were being yelled at were mischaracterizations of things that are going on.
Okay, can you have any examples of that?
Yeah, I have a perfect example. Right across the road, there's a woman who's holding a sign that says, "Seniors are Obama's clunkers." What she's referring to is there's 5 bills. There's not one bill that's been passed yet. In the 5 bills, and one of the House bills, there's a provision that if a senior wanted to have a consultation about filling out a living will, they could have it paid for in their Medicare. So here is something where it's optional and something that I really believe that everybody should do. My mom died in April and she had a living will, and when she went into a coma, I was able to carry out her wishes because she had clearly stated them.
But have you been able to read the whole bill yourself?
No, but what I have done is gone to the controversial provisions and read those pages, and in the page it's absolutely optional, not mandatory, for seniors. So to be stating that this is a bill that's promoting euthanasia is just, you know, it's just scare tactics.
Okay, don't you think it's a good idea that Congress should slow down and address these concerns instead of trying to rush the bill through?
Well, the reason, as far as I understand, that they wanted to have a bill passed before the August recess is so we would actually be able to debate a bill. Right now, there is no bill. They were going to take August and do the reconciliation between the House and the Senate to try to create a real bill so people could then have town halls and discuss it. But right now, people are picking out provisions from 1 out of 5 proposals. The president has not put out a specific proposal himself. He's stated general principles and guidelines. And people are standing carrying signs saying things that are not in any of the proposals.
Okay, one of the main criticisms about the bill is that it doesn't address tort reform.
Which bill?
About the bill in Congress, the House,
5.
Right? But the House bill that came out of committee,
right?
Okay, the 1,000+ page bill,
right?
People are criticizing that there's not enough or any tort reform in that bill. And don't you think that a lot of doctors and healthcare professionals have to give tests that are basically unnecessary to cover their legal liability, and that drives up the cost of healthcare somewhat?
Yeah, well, absolutely, and President Obama has addressed this. He addressed this when talking to the AMA, even though he said he's not coming out specifically for caps, but he did say that he's interested in tort reform, and all of us feel that malpractice insurance has driven the cost way out of whack. But why not get a bill together and then fine-tune things rather than going around saying that it's socialized medicine or that it promotes euthanasia?
Okay, I understand your position. A lot of people seem to be afraid that once it gets through the House and it's just the Senate left,
yeah,
and you know they feel afraid that they're outnumbered and then it's going to be pushed through.
There's a guy over here who came over from the other side with his sign, and when I asked him about this, he said, "Oh, well, I know it's not in there, but it will be once they get this." So there is a lot of fear. People are fearful of change. People are generally suspicious of the government. They always feel that when the government does something, it becomes a big bureaucracy.
Do you think there's any validity to that, being afraid of the government and afraid of bureaucracy and an overgrown government? Do you think there's any validity to that fear?
Having been in situations where we've sent series of letters back and forth to health insurance bureaucrats, I really think that bureaucracy is bureaucracy is bureaucracy. And what I would like is for the town halls to take place all over and for everybody to sit and listen to each other.
Okay,
that's what we need.
That sounds reasonable. Thank you very much. Appreciate it. Thank you. Okay, sir. You had a comment about people who are concerned about the government being over-intrusive and the bureaucracy growing too large. What do you have to say about that?
Yeah, bureaucracy way too large. It's you know, as local as you can get is the best form of government. So that in that case, I'm a conservative all the way. But usually this spin on get the government off our backs is usually, yeah, sure, get the government off our backs, because the government is basically owned by corporations. Get money out of government, but we are the government. You know, we have a government of the people, for the people, by the people. I'm the government. This is the free market at work, right here, okay?
And do you feel they have equal right, the people in the opposition?
Equal right, of course.
Okay, so what do you think about the White House trying to get information about who these protesters are?
Wait, and first of all, who are you from?
I'm a private citizen. I watch the news just like everybody else, and I'm listening to what's being said, and I want to get both sides of the issue.
Okay, and what's your question?
My question is, does it make you concerned? You said you feel they have every right to protest, just like you do. But when you hear from such a powerful entity as the executive branch, the White House, talking about gathering information on citizens who are protesting, does that make you concerned?
I haven't even heard about that.
Okay, well, it's been on the news, and some people are concerned that that might be happening and they might become targets.
Oh, God, yeah. I mean, but I would be concerned about that. You know, if that's true, and I don't know much about it, then I would definitely be concerned about that. But I would also want to distinguish is that the difference between just basically trying to find out what is behind, you know, things like this. Are there big insurance company dollars behind this AstroTurf, you know, community?
Well, they're saying...
And also, what's behind us? You know,
right, what's behind you?
Why do we do what we want to do?
Okay, you're aware of Acorn, right? And are you also aware that...
I'm a little bit of Acorn. I'm also aware of the smear on Acorn. From what I've heard, Acorn is an incredibly good community organizer.
Okay, but Acorn gets involved in protests, community protests, and organized rallies. Right, community organized rallies. But are you aware that part of the stimulus bill money went to fund Acorn? These people don't seem to be funded by any stimulus money.
I mean, I don't know individually who these people are. But this organization, this movement, is being funded hugely by insurance companies, big pharma.
Where's your evidence of that?
Well, I have actually some right here, if you want some. I'm not a walking computer, but if you actually. So, for instance, if you read the latest copy of Extra, okay, Fairness and Accuracy Reporting, you know, you have people sitting on boards of big pharma, big insurance companies, but also sitting on the boards of NBC and or GE and stuff like this. And the corporate media repeats enough and enough.
Okay, so single payer doesn't concern you. Single payer meaning that the government...
Single payer concerns me a great deal.
Well, no, I mean, you think of it in a positive light, where you want the government to pay for everyone's health care.
No. See, that's the slip. I want the government. We are the government. We have taxes. Do I want my government paying for roads? Do I want my government paying for... Yeah, I mean, government, we're the government. We take our taxes, right, and we pay for stuff.
So you feel these people across the street are not taxed enough, then?
What's that?
You don't believe they're taxed enough? Is that what you're saying?
May not be. I don't know. I have no idea who these people are.
Well, if you're going to add another huge 1/7 of the economy, which is what healthcare,
the health taxes back to what it was under Reagan.
But the estimation from economists, okay, let's
what economists?
The Congressional Budget Office.
Okay, yes. Now,
the Congressional Budget Office estimates 1/7 of the U.S. GDP is what it will cost to run the healthcare system as defined in the new bill. And do you think that additional liability of the taxpayer, you think that's justified?
I believe that bringing taxes back to Reagan's era is a fine thing. Yes.
Well, during Reagan's era, the tax rate didn't go up to 60% like it would go under with this new proposal.
Where's that coming from?
That's what that's what the Congressional Office budget said.
Okay, and actually, by the way, it's funny. You're just a concerned citizen.
Yeah, I am.
Yeah, I know. What I do know is private, profit-based healthcare has not worked. 45 million people without health care.
And you don't think it can be fixed without totally reconstructing the whole system?
No, I don't.
Okay, fair enough.
The system is broken big time. Not just health care. What you call the government. The government is owned by big money.
So you wouldn't mind a system like they have in Canada or England? You wouldn't mind a system?
Exactly.
Okay, thanks for your honest opinion. Thank you.
You're welcome.